Okay, so we're going to be looking at overhead shoulder mobility. So when we lift our arm and our elbow flexes, or we lift our arm and we feel stiffness in the shoulder capsule, in this general or kind of in this crescent shapes in the posterior aspect of the shoulder or deep within the shoulder, any of those descriptors would suggest that we don't have enough rotation above our head in our capsule. So one self-check that I could do is I would go like this, and then I am sitting on a stool, and I'm going to rotate back. And as I rotate back, you can see that I collapse in, meaning that I've lost my external rotation, despite my best efforts to hold and sustain my forearms there. Okay, so what is the cure for this? The cure is using some long duration stretching and some contractions to do so. So I'm gonna now have a rigid lever, golf club, cane, dowel, all work well. Okay, so then I'm gonna go back into it, which now I can sustain that external rotation. There's gonna be 4 phases with this. Phase 1 is gonna be a long duration stretch where I'm gonna push my arm out to my right and stretch. Okay, so that's my end range. During this 1 minute, I'm gonna breathe in, 4 seconds in, 8 seconds out. This helps to stimulate my vagus nerve, relaxing my central nervous system, allowing tissue extensibility to blossom, and I may gain a degree or 2 further. Thereafter, I'm gonna engage, and that is to say, I'm gonna try and actively push into internal rotation. So it's going to be unremarkable because I'm going to hold strong with my left. So it's going to be an isometric contraction. This is going to induce architectural change within the shoulder joint as I engage the deep tissues, that is my rotator cuff of my right shoulder, putting mechanical impulses into the capsule to make it change range of motion. I do that for 30 seconds, incrementally, gradually increasing my force. My safest, greatest contraction, as hard as I can go to my right, or excuse me, to my left in this case. Phase 3, I'm gonna actively, as best as I can, try and pull the cane to my right. Okay? So all my deep tissue on my right shoulder is now pulling out to the side. 30 seconds, as long as I can go. Keep going, keep fighting, keep working, keep doing it. Yes, good. Then, end of that, I solidify the new range of motion by breathing 4 seconds in, 8 seconds out. Okay, not just surviving the position, but trying to own it. Okay, I'm going to slowly come up and out of it, knowing that it's natural for my shoulder to be a little bit achy and stiff and feeling like it's just worked really hard. If I give this impulse and this stimulus to my tissue day in and day out, I'm going to make meaningful changes over weeks, days, months.